I had a patient this week also who came in. She'd already received connective tissue grafting from another doctor. And what had happened is the procedure was performed, and she didn't think it was terrible, although she did have discomfort for a week or two after the procedure. What really brought her in to see us rather than going back to where she had been was that a recession reoccurred. In the process of treating gum recession, you have to address what caused the recession as well as repair the recession itself. And sometimes it's due to a patient's bite. I can put my fingers on their teeth as they're grinding their teeth from side to side. I can actually feel their teeth move. And if their teeth are moving, that's part of the cause of the gum recession. If you don't correct that prior to repairing it, then after a year or so, the recession reoccurs. Other causes would be muscle attachments and thin tissue. Muscle attachments can really be a problem too. I've seen this in lots of cases. A graft is done and then the muscle pulls it back down. In this particular patient's situation, it turns out she had a clenching and grinding problem. And when she'd clench and grind, she could actually make her teeth wobble a little bit. And that wobbling motion actually led to her recession, slowly progressive over time. And so she'd had connective tissue grafts, and then a couple of years later, the recession had all reoccurred. So to correct that, we had her bite on this computerized sensor, and it made a digital movie of her bite. I was able to adjust her bite in such a way that when she clenches and grinds her teeth now, the teeth no longer move. And then we did a pinhole procedure to repair her recession, and the pinhole is so much different than connective tissue grafting. It's a minimally invasive procedure that you can see the results of the same day you do the procedure. So I think that's a kind of a common story in our practice. Is we do see quite a few patients who have been somewhere else and had something done that didn't work out as well as they wanted to, and then we come back and address the underlying causes and correct the problem as well.